everyone, welcome to another video. So in today's video we'll be looking at another topic. This is a very common topic, so we'll be looking at asthma. And basically asthma is a chronic disease, it's a long-term disease, and it particularly affects the airways. So the airways are the tubes that carry air in and out of the lungs. So asthma particularly affects the airways, and in asthma these airways, they become inflamed, they become narrow, and they may produce excess mucus, making it difficult or hard for the person having this condition to breathe. So asthma can start at any age, although it often begins in childhood, and it can range from mild and occasional to severe and persistent. So there are different ways that asthma can come. So to understand asthma, we have to understand what normally happens when we breathe, like when we breathe in, when we breathe out. So basically air enters through the nose or through the mouth, then it goes down the windpipe. This windpipe is known as the trachea, and then so this windpipe is somewhere around here. So it enters through the nose, goes down the windpipe, and then it enters two main airways known as the bronchi. So these bronchi, they branch into smaller airways known as the bronchioles, ending in tiny air sacs known as the alveoli, where the oxygen is exchanged. So these airways, they have smooth muscles around them, and they are lined with mucus producing cells. So in cases of when a person has asthma, the muscle tightened, like these muscles, they tighten, which is known as bronchoconstriction, and the lining of the airways swells due to inflammation. Then thick mucus is produced, and this combination now narrows the airways, making it difficult to move air in and out. So for the pathophysiology of asthma is primarily an inflammatory disease. When a person with asthma encounters a trigger, number one, the immune system overreacts. Number two, the white blood cells like the eosinophils and the mast cells, they release chemicals. So they release chemicals, and these chemicals cause inflammation, muscle tightening, and mucus overproduction. So this results in narrow airways, causing symptoms like wheezing, coughing, and shortness of breath. So looking at the causes and triggers of asthma, so number one, allergens, like for example dust mites, pollen, mold. So people have different things that they're allergic to. So allergens is the first one. Then infections, especially viral respiratory infections. Then exercise, especially exercising in cold or dry air. Then dry environments. Then weather changes, pollution and cigarette smoke, strong emotions like when the person is laughing or crying, medications like certain painkillers can trigger this asthma, and then gastroesophageal reflux, so acid rising into the throat is another trigger. So looking at the signs and symptoms, for asthma there's wheezing. This is like a whistling sound when breathing, and then there's shortness of breath, tightness in the chest, coughing, especially at night or early in the morning. Then difficulty sleeping due to like breathing problems, and severe attacks of asthma can cause difficulty speaking, bluish lips or fingertips because you're not getting enough oxygen. Then rapid breathing, and it can also cause fatigue or confusion. So how exactly is asthma diagnosed? So for the diagnosis, asthma is diagnosed based on medical history, physical examination, and lung function tests. So the steps in diagnosis, basically number one, the history. So the doctor will ask about like frequency of the symptoms, like nighttime awakenings, and they also ask about the triggers, like what what do you take before you get these symptoms, before you start seeing these symptoms. Then also the doctor will try to get your family history. If there's a family history of asthma in your family, there's a likely chance that you can also get asthma. So then physical exam. So the doctor will look for symptoms like wheezing, rapid breathing, or signs of allergy. So normally he would use like the doctor will use the stethoscope to listen to like your breathing, and then he can hear like these signs of wheezing and all these things. And another thing is lung function test. Like for example, there's one known as peak expiratory flow rates. So this basically measures how fast air can be blown out of the lungs, and usually low values suggest that the person has narrowed airways. Then spirometry. So it's a detailed lung function test that measures, number one, the amount of air that is exhaled in 1 second, which is known as a forced expiratory volume. Then number two, the total amount of air blown out, which is known as forced vital capacity. Then there's also another test known as bronchodilator test. So improvement in lung function after using a bronchodilator that supports asthma. So after using this bronchodilator, they will do this bronchodilator test. Then allergy testing too may be done to identify triggers, like what exactly is causing these asthma attacks. Then chest x-ray is often done to rule out like other conditions, like maybe the asthma is due to a viral infection or heart disease. So other conditions that may look similar to asthma: number one, chronic obstructive pulmonary disease, usually, which is very common in older smokers. So this also has similar symptoms that we see in asthma because it also affects the lungs. Then heart failure too, bronchitis or pneumonia. Then some anxiety disorders that cause hyperventilation, and also having a foreign body in the airway, especially in cases of like younger children. So for the treatment options for asthma, so we have reliever medications that are used during like acute attacks. So when somebody has an asthma attack, we use these reliever medications. Then we also have maintenance medications, like they call them controller medications, which are taken daily to actually prevent the attacks. So what we can use during the asthma attack, so we can use short acting medications because we need quick relief, quick response. So short acting bronchodilators like salbutamol helps to relax the airway muscles within minutes, and this salbutamol there is usually inhaled and it provides a quick relief during acute attacks. Then for controller medications that are used daily to prevent attacks, so we have number one, inhaled corticosteroids like budesonide, which helps to reduce inflammation. Then we have long acting bronchodilators like salmeterol, which helps to keep the airways open. Then we have leukotriene modifiers like montelukast, which helps to reduce inflammation and reduce mucus. Then monoclonal antibody treatments, which are used only in severe cases, and these are injections that block some parts of the immune system. So when we're advising patients that have asthma, it's good to advise them about the correct way to use their inhalers, and try to advise them to use spacers to improve the delivery of the medication to the lungs. And then when using corticosteroids, it's good to rinse the mouth to prevent a known side effect of using corticosteroids is known as oral fungal infection. So to prevent this oral fungal infection, it's good to rinse the mouth after using corticosteroid inhalers. And also try to avoid triggers. If you know, okay, when you inhale smoke, this asthma attack starts, or when you are in a environment filled with dust, or when you smell all these perfumes that have a very strong scent. So just try to avoid triggers. Then follow medication plans strictly, even when you don't have symptoms. That's why there are preventive medications that you can take daily. Even when symptoms are not present, try to stick to a medication plan, because there are some people that it's only when this asthma comes, like in the acute stage, that is when they will remember, oh, I have this inhaler, I am an asthmatic patient, I have this inhaler, oh, let me start looking for it. So it's good that even the times when you don't have symptoms, you just remember that, okay, you need to take your medications. Then try to vaccinate if try to take influenza and pneumonia vaccines, which help to reduce the risk of having respiratory infections. And so in summary, this asthma is a long-term disease, and it causes inflammation and narrowing of the airways, leading to coughing, wheezing, and breathlessness. And it's caused by an overreaction of the immune system to triggers like dust, smoke, infections, or exercise. So the diagnosis basically involves history taking, lung function test, physical examination, and trying to rule out similar conditions. And treatment includes quick relief inhalers for acute attacks and long-term medications to prevent symptoms. So good management of this asthma condition involves avoiding your triggers, taking your medications as prescribed, and monitoring your breathing regularly to know when something is like off. So that is basically it for this topic. So I'll see you in the next video. Bye.